Hi all, welcome to Physio Exam Buddy. This video will help you to answer all the questions related to the topic cardiac output, and it is prepared according to the new CBME curriculum competency number PY 5.9. By watching this video, you will be able to answer all these questions, that is factors regulating cardiac output, stroke volume, heart rate, and diastolic ventricular volume, and venous return. So every answer regarding cardiac output should start with the definition of the cardiac output, that is the amount of blood pumped out by each ventricle per minute. Don't get confused with the definition of the stroke volume. It is the amount of blood pumped out by each ventricle per beat, but the cardiac output, the definition is per minute. Next, you have to write the formula, that is cardiac output is equal to stroke volume multiplied by heart rate. The value of stroke volume is 70 ml per beat and the average heart rate is 72 per minute. So when you substitute this in the formula, you will get the cardiac output as 5 liter per minute, which is the normal value. So first definition, then the formula, then the normal value. Now we are moving on to the factors regulating cardiac output. So we have already seen that cardiac output is equal to stroke volume multiplied by the heart rate. So factors affecting cardiac output will be the factors affecting stroke volume, that is preload, afterload, myocardial contractility, and the factors affecting the heart rate, neural, chemical, physical. So the factors affecting stroke volume you can explain under these three headings and heart rate under these three headings. So first we will see what are the factors affecting the stroke volume, and that is first we will explain on the preload. So what is this preload? Preload, it is also known as heterometric or intrinsic regulation. So it is the degree to which the myocardium is stretched before the heart starts contracting. So the load acting on the heart before the heart starts contracting, that is the preload. And here there occurs change in the cardiac muscle fiber length, that is why it is known as heterometric or intrinsic regulation. Before going to see in detail about the preload, we have to first write about the Frank-Starling's law or Starling's law of heart. The law states that the force of contraction is directly proportional to the initial length of the muscle fiber within physiological limits. So, in case of heart, the initial length is directly proportional to the end diastolic volume. So, preload is normally equal to the end diastolic volume. So, any factor which increases the end diastolic volume will increase the preload and thereby the stroke volume and thereby the cardiac output. So we will see what are the factors affecting end diastolic volume. Then only we will get what are the factors affecting the preload and the stroke volume and the cardiac output. So we can describe the factors affecting end diastolic volume under two headings. One is venous return and the second is ventricular filling. Under venous return, you have to explain these five terms, that is skeletal muscle pump, respiratory pump, venous tone, blood volume and posture. And under ventricular filling, you have to explain three things, that is atrial contraction, intrapericardial pressure and ventricular compliance. We will see the first factor, that is skeletal muscle pump, which affects the venous return. During muscular activity, what happens is that our skeletal muscles will contract, and in between our skeletal muscles, we have the veins. So, due to this contraction of the skeletal muscles, there occurs squeezing of the veins in the muscle, which will drive the blood towards the heart. The backflow of the blood is prevented with the help of the venous valves. So whenever more and more amount of blood is driven to the heart, it will increase the venous return. That means there is an increase in the end diastolic volume, which will increase the initial length of the muscle fiber. So according to Frank-Starling's law, what happens when the initial length increases? There will be an increase in the force of contraction, and which will increase the stroke volume, and thereby it causes an increase in the cardiac output. Second factor is the respiratory or thoracic pump. During inspiration, actually, our cardiac output increases. And there are two reasons for the increase in cardiac output during inspiration. One is there is an increase in the negative intrathoracic pressure, which will drive the blood towards the heart. And also during inspiration, there is a descent of the diaphragm, which will increase the intra-abdominal pressure and also divert the blood from the viscera towards the heart. So both these things will increase the venous return, thereby our stroke volume and cardiac output. Third factor is the venous tone. The walls of our veins, they are made up of smooth muscles and it got the innervation from our sympathetic nervous system. During sympathetic activity, what happens is that there occurs increase in the venous tone or contractions of the smooth muscles. So because of the increase in the venoconstriction, what happens is that there will be decrease in the pooling of the blood in the veins in the lower limb. So it actually increases the venous return and there will be increase in the stroke volume and thereby the cardiac output. Fourth factor is the blood volume. Whenever there is an increase in the blood volume occurs in our body, it causes an increase in the venous return, again increase in stroke volume and cardiac output by Frank Starling's law. And the last factor which affects the venous return is the posture. So you can see here that when a patient lie down, what happens is that more and more amount of blood is driven into the heart. So there is an increase in the venous return. So again by Frank Starling's law, it will increase the cardiac output. Now what happens when the subject is in erect posture or in standing position? Again, there occurs pooling of the blood in the lower limb, which will decrease the venous return and thereby decreasing the cardiac output. So in lying down position, it actually increases the cardiac output due to increase in venous return, whereas in erect posture, there occurs venous pooling, which decreases the venous return and decrease the cardiac output. So we have finished with the factors affecting venous return, thereby affecting the end diastolic volume and the stroke volume and finally the cardiac output. Now we are moving on to the factors affecting the ventricular filling. So about the first factor which affects the ventricular filling, that is atrial contraction. Whenever there is an increase in the atrial contraction, the atria will pump blood into the ventricle. So it causes an increase in the ventricular filling, which will further increase the end diastolic volume. So according to Starling's law, again increase in stroke volume and cardiac output. And this atrial contraction increasing the cardiac output. This mechanism contributes more when there is an increase in the heart rate or tachycardia in a subject. The second factor affecting the ventricular filling is intrapericardial pressure. You know that the heart, it is surrounded by a cavity of which is known as the pericardial cavity. And in the pericardial cavity, there is pericardial fluid. The condition in which there is increase in the secretion of the pericardial fluid, it is known as pericardial effusion. So what happens in pericardial effusion is that the pressure in the pericardial cavity increases, which will actually block the ventricular filling or decrease the ventricular filling. So there will be a decrease in the end diastolic volume and according to Starling's law, decrease in stroke volume and decrease in cardiac output. The third factor which affects the ventricular filling is the ventricular compliance. Mainly in conditions like myocardial infarction, what happens is that our myocardium becomes fibrotic as well as non-functional. So there is an increase in the ventricular stiffness, which will decrease the ventricular compliance. Compliance means either stretchability or distensibility. So the stretchability of the ventricle will decrease, which means it will decrease the ventricular filling, thereby decreasing the diastolic volume and decrease in the stroke volume and cardiac output. So that is about the factors which affect the preload of the heart. We have completed the first factor affecting the stroke volume, that is the preload. Now we will see the second factor affecting the stroke volume, that is afterload. So what is this afterload? It is the resistance against which the ventricle has to pump the blood or the load acting on the heart after the heart contracts. So this afterload parameter, it mainly depends upon the pressures in the aorta or pulmonary artery as heart is pumping blood from the left ventricle and the right ventricle to aorta and pulmonary artery respectively. So this pressures in the aorta or the pulmonary artery in turn depends upon two parameters, that is peripheral resistance and viscosity. What happens when there occurs an increase in the peripheral resistance or viscosity? It will actually increases the afterload, which has got an exact opposite effect on the stroke volume. That is, increase in afterload causes a decrease in the stroke volume and thereby decreasing in the cardiac output. So any factor which increases the peripheral resistance or viscosity of the blood will actually decrease the cardiac output. So we have finished with the preload, that is increase in preload will increase the stroke volume, whereas increase in the afterload will decrease the stroke volume, and we will see the next factor, that is the myocardial contractility. The factors affecting myocardial contractility, it is actually independent of the muscle fiber length. So this type of regulation of the stroke volume, it is known as homometric regulation or extrinsic regulation. And it mainly depends on the increase in the calcium availability and changes in the myocardial cells, which so the increase in the myocardial contractility will basically cause an increase in the stroke volume. Factors affecting myocardial contractility and thereby the stroke volume can be divided under three headings. You can explain this under three headings, that is neural, chemical and others. Neural factors again we can divide under two headings, that is sympathetic as well as parasympathetic effect. What happens when there occurs a sympathetic stimulation? It causes an increase in the secretion of our catecholamines, that is epinephrine and norepinephrine, which will bind to the beta-1 adrenergic receptors in the heart, and it causes an increase in the cyclic AMP level. You all know that cyclic AMP is a second messenger, which causes the activation of many protein kinases, especially protein kinase A. So whenever this intracellular enzyme protein kinase A is activated, it causes phosphorylation of the voltage dependent calcium channels, and it prolongs the opening of the calcium channels, which causes increase in the influx of the calcium, and thereby causing an increase in the force of contraction or myocardial contractility, thereby increasing the stroke volume. Another action of the increase in cyclic AMP level is that it can actually increases the active transport of the calcium back into the sarcoplasmic reticulum, which will decrease the intracellular calcium concentration, which will actually causes the relaxation or increase in the relaxation, thus decreasing the duration of the systole. This is especially important whenever our heart rate is increased, that is, it will permit adequate diastolic filling, that is, our end diastolic volume will increase and thereby the cardiac output also increases. And this increase in the strength of the contraction or myocardial contractility occurs without the increase in length, and thereby it also causes an increase in the ejection fraction as well as decrease in the end systolic ventricular volume. Now, what is the effect of parasympathetic stimulation? Exact opposite of the sympathetic, that is, it will decrease the cyclic AMP, it will slow the opening of the calcium channels, decreases the firing rate as well as decrease in the force of contraction and decrease in the cardiac output. Now we will see what are the chemical factors which increases the myocardial contractility. They are catecholamines, xanthines like caffeine and theophylline, which usually inhibit the breakdown of cyclic AMP, thereby increasing the intracellular calcium. And another chemical is the glucagon, which increases the formation of the cyclic AMP. Then thyroid hormone as well as aubane and other digitalis glycosides will increase the myocardial contractility. The factors which causes a decrease in the myocardial contractility are hypoxia, hypercapnia, acidosis, and drugs like quinidine, procainamide, and barbiturates. And there are certain other factors which also affect the myocardial contractility, that is intrinsic depression of the heart, as in case of heart failure will decrease the myocardial contractility and thereby decrease in the stroke volume. Loss of myocardium, as in case of conditions like myocardial infarction, will also decrease the myocardial contractility. Whereas after a ventricular extrasystolic, that is post extrasystolic potentiation is occurring there. So the succeeding contraction will be actually stronger than the preceding normal because of the increase in the availability of the calcium. So in case of ventricular extrasystole, there is an increase in the force of contraction and increase in stroke volume and thereby the cardiac output. So we have finished with the factors affecting the stroke volume, and we have seen how to explain under three headings, that is preload, afterload and myocardial contractility. Now we will see what are the factors affecting heart rate. So the normal heart rate, it is between 60 to 100 per minute, and tachycardia is a condition in which the heart rate goes above 100, and bradycardia is a condition in which the heart rate goes below 60 per minute. So we have seen that three factors influences. Under heart rate, we have to explain three factors. The first one is the neural factors. We will see what are the neural factors. Neural factors. Actually, the sensory input will come from our baroreceptors as well as the chemoreceptors, and it is actually transmitted to the nucleus tractus solitarius, which is situated in the medulla, and from there sympathetic as well as parasympathetic outflow is going to our heart as well as blood vessels. Vagal outflow or parasympathetic outflow is mainly into the heart, whereas sympathetic outflow is going both to the heart as well as blood vessels. The higher centers as well as the hypothalamus will modify these responses or cardiovascular responses to emotion and stress. That is basically whenever there is sympathetic stimulation, it has got a stimulatory effect both on the heart as well as blood vessels. Whereas if there is vagal stimulation, it has actually an inhibitory effect on the heart. Regarding sympathetic innervation of the heart, there is a vasomotor center which is our rostral ventrolateral medulla. It will secrete the neurotransmitter glutamate and it will act on the intermediolateral horn, that is T1 to T5 spinal segments. And from there, the innervation goes into our sympathetic ganglia, and from the ganglia arises the postganglionic fibers as well as the vagal fibers, which will supply our heart as superficial and deep cardiac plexus. So, what is the effect of sympathetic stimulation on the heart? Sympathetic fibers are cardio-acceleratory nerves. Upon stimulation, it increases the heart rate. That is why it is known as positive chronotropic via its action on the beta adrenergic receptors. It increases the contractility, that is the positive inotropic effect. It also increases the conductivity or dromotropic effect. It also increases the excitability of the heart, which is commonly known as positive bathmotropic. Whereas on the blood vessels, it actually causes vasoconstriction by its action on the alpha adrenoreceptors. Next on the parasympathetic innervation. The parasympathetic output to the heart is mainly through the vagus, and it mainly comes from our cardio inhibitory center, that is the nucleus ambiguous as well as the dorsal motor nucleus. From these nucleus, the fibers arise and descend through the main trunk of the vagus, where the fibers of the heart are separated and it will get mingled with the sympathetic fibers to form the superficial as well as deep cardiac plexus, and this will supply the SA node, AV node as well as the atria, and the ventricle is only sparsely supplied. An effect of parasympathetic stimulation is that our acetylcholine is a neurotransmitter from the vagal nerves, and it will act via the N2 muscarinic receptors, and it will decreases the heart rate, that is negative chronotropic, decrease in the contractility of the heart, that is negative ionotropic, then decrease in the conductivity of the heart, that is negative dromotropic, and decreases the excitability of the heart, that is negative bathmotropic effect. So we have finished with the neural factors affecting the heart rate. Now we are moving on to the chemical factors. The first factor is catecholamines. That is, epinephrine will cause tachycardia, whereas norepinephrine will cause reflex bradycardia by the stimulation of the baroreceptors. Then hypoxia, hypercapnia as well as thyroxine will increase the heart rate. Drugs like atropine and adrenaline increases the heart rate, whereas propranolol and digitalis is found to decrease the heart rate. Next, about the physical factors affecting heart rate. Temperature increases the heart rate, whereas exercise also increases the heart rate. So that finishes the factors affecting the heart rate. So to summarize, increase in stroke volume as well as increase in heart rate can increase the cardiac output. Increase in the preload, decrease in the afterload, and increase in the myocardial contractility. All these three factors, that is increased preload, decreased afterload, and increase in the myocardial contractility will contribute to increase in the stroke. Whereas sympathetic stimulation will cause increase in heart rate. Chemical factors like catecholamine, calcium, thyroid hormone also increases the heart rate. Increase in temperature as well as exercise also increase the heart rate. So increase in the stroke volume occurs and increase in the heart rate occurs, which will contribute to the increase in the cardiac output. Thank you for your patient listening and keep on watching Physio Exam Buddy, which makes your physiology exams more easier.